Birth defects are differences in the way your child's body develops. A birth defect is an abnormal growth change in the body that happens during fetal development, leading to abnormal structures in the body. It can affect different organs such as the heart, brain, kidneys, intestines, spinal cord, facial structures, and limbs. About 1 to 3% of the general pregnant population will have a child with a birth defect. There are many different causes of birth defects. They can be due to genetic conditions, which can be new or random genetic changes or chromosomal abnormalities that don't necessarily run in the family, or caused by inherited genetic syndromes or diseases. About 20% of birth defects are due to genetic factors. Birth defects can also be due to medical conditions, such as poorly controlled blood sugars in people with diabetes, maternal obesity, and advanced maternal or paternal age. Environmental factors can cause birth defects with exposure to certain substances and chemicals, such as pesticides, herbicides, radiation, and importantly, non-medical drug use in pregnancy, especially alcohol. Marijuana and other drugs can affect fetal brain development. There are some medications that can also increase the risk of birth defects. Birth defects can also be caused by pregnancy complications, including low amniotic fluid volume and certain infections that can affect the development of the fetus. More than half of birth defects are random and their cause remains unknown. So there are many different types of birth defects. The most common birth defects are heart abnormalities, cleft lip and palate, Down syndrome, and spina bifida. Clubfoot, fetal alcohol syndrome, cystic fibrosis, sickle cell anemia, and bone growth abnormalities that cause short stature are also common. Multiple birth defects that occur together are often part of a genetic syndrome, such as Down's or Turner's. Birth defects can affect any organ system in the body, including the heart, nervous system, urinary tract, bowels, skeleton, skin, and muscles, as well as hormones, the immune system, and genitals. Not all of these can be detected prenatally, and sometimes they might only be found later in the pregnancy or after birth. Screening blood tests and ultrasounds during the pregnancy might indicate an increased risk of birth defects. Major structural birth defects, especially of the brain and the heart, can be seen on a first trimester ultrasound, and ultrasound abnormalities early on might also indicate an increased risk of certain genetic and chromosomal abnormalities like Down syndrome. Maternal serum screening blood work or non-invasive prenatal genetic screening, NIPS, blood work can indicate an increased risk of fetal chromosomal conditions as well. In the second trimester, the anatomy screening ultrasound checks the size of the fetus and also looks for birth defects. If any of these screening tests are abnormal, your prenatal care provider may offer you diagnostic testing, which might include a fetal echocardiogram to look at the fetal heart in more detail, or a fetal MRI to look at the fetal brain and nervous system in more detail. You might also be offered invasive diagnostic testing with chorionic villus sampling, where a very small piece of the placenta is collected and examined for chromosomal or genetic conditions, or an amniocentesis, where a small amount of amniotic fluid is collected and checked for chromosomal or genetic conditions, and can also be tested for certain infections. Management options or treatments that aim to repair or minimize the impact of those birth defects may include surgical management, it might include medications, physical therapy, or the use of assistive devices such as a wheelchair, glasses, hearing aids, or a brace. For conditions associated with developmental delay or learning difficulties, individuals affected with those conditions may require educational supports in school. There are also organizations in the community that support parents and families who have a child affected by a birth defect. There are some very severe life-limiting birth defects that do not have any established long-term treatments, and in that case, the management plan might involve comfort care for the newborn. If you are trying to get pregnant, or if you are sexually active and not using contraception, taking a prenatal vitamin with 0.4 to 1 milligram of folic acid can reduce the risk of birth defects of the brain and spinal cord by more than 70%. It can also reduce the risk of certain heart and urinary tract defects, cleft lip and palate, and certain limb abnormalities. Avoiding alcohol, marijuana, and other non-medical drugs in pregnancy can also reduce the risk of birth defects. Making sure you contact your healthcare provider as soon as you think you are pregnant, seeing them for prenatal care on a regular basis, and asking about the impact of any medications and supplements that you are taking can also help reduce your risk.